I would like to provide you with some highlights of the session on treatment-induced bone loss in breast cancer patients presented by Dr. Payman Haji and Dr. Rob Coleman. Dr. Haji presented risk factors for bone loss in patients with breast cancer treated with aromatase inhibitors. These agents, by lowering circulating estrogen levels, protect from breast cancer recurrence. They are typically used for many years. There are effects in decreasing bone density and increasing fracture risk are well known. There have been a number of studies looking at therapies which might be useful in preventing this treatment-induced bone loss and preventing subsequent fractures. Agents studied include oral and intravenous bisphosphonates as well as denosumab. The bisphosphonates do not have regulatory approval for the management of treatment-induced bone loss, but bone density data are consistently positive. With bisphosphonates, there are no fracture data available. With denosumab, bone density increases despite aromatase inhibitor therapy. A recent Austrian study demonstrated a 5-year fracture risk of about 20% in patients on aromatase inhibitor, and this was reduced by half by giving denosumab. The anti-fracture benefit was consistently observed in both patients with osteopenia and patients with normal bone density. In this same study, disease-free survival improvements of 20% were seen in patients on denosumab compared with placebo. Dr. Coleman went on to explain the long history of anti-resorptive therapy use in the prevention of breast cancer bony recurrence. It was suggested by individual studies that bisphosphonates, clodronate, and zoledronic acid may alter bone characteristics, preventing reactivation of metastatic cancer cells in bone. He reported last year a very large meta-analysis of individual patient data from many of these studies, conclusively showing reductions in skeletal recurrence of breast cancer in patients given clodronate or zoledronic acid. This meta-analysis also demonstrated a 15% reduction in mortality in women on bisphosphonate after breast cancer diagnosis compared with those not given bisphosphonate. Since breast cancer is the most common cancer in women, this 3% absolute reduction in mortality in breast cancer patients would represent thousands of lives saved every year in Europe. We took away from the session new information on breast cancer treatment-induced bone loss, as well as a new imperative to attend to bone health concerns in patients on aromatase inhibitor therapy.